Welcome, everybody, to the International College of Integrative Medicine podcast, translating science into clinical practice since 1983. I'm your host, Luke W. Russell, and I'm joined by Dr. Mignonne Mary. Dr. Mary, thanks for sitting down with me.
Thank you for having me.
So could you tell me a little bit about your practice?
Okay. So our practice is pretty innovative. It is an infusion clinic where we take care of patients who have nutritional deficiencies, who are dehydrated from whatever the cause. A large portion of people want to talk to us about hangovers because, of course, we live in New Orleans, and what better place to have a facility to take care of these people so that they can keep enjoying our city. But a greater portion of our patients are suffering from chronic diseases, including cancer, but we treat a very wide range of athletes, just tired moms, people who are traveling, who have jet lag, you name it. So,
what's been new lately in your practice?
New in the practice, it's not new, but we've picked up the pace on telling more people about it, is the use of IV NAD, NAD+, and this is a derivative of B3 or niacin, and we are seeing very incredible results with people having people who want to detox off drugs and alcohol naturally, who are looking to get off of Suboxone, or who are looking to they may end up going to a 12-step program or something after, but physically they just can't get over the cravings. So it's very helpful for that. And within 10 days, they don't want the drug or the alcohol. And the beauty of it is it's raising the dopamine level by 6 times. So they have a brighter outlook, they have clarity of mind, they're sleeping better, and it's really given them a fresh start, and it gives them sort of a window of opportunity to listen and engage and be involved with whatever program they choose to do to try to stay off the drugs. We're using it from a medical perspective with patients who have anything wrong with their mitochondria. So whether that's fatigue, people who suffer from anxiety, people who have PTSD, depression, and even just we have businessmen and people who are looking from an anti-aging perspective because of the power of the mitochondria. It repairs it and it helps to grow new mitochondria. So that's pretty huge when it comes to trying to avoid aging or aging gracefully.
Yeah. Now, talk to me about fasting, because I know you've mentioned fasting is a big part of what you do.
It's a really big part. And I would say in the 20 years I've been a doctor, it has had the biggest impact on my practice. And we've taught patients how to do intermittent fasting, and a lot of obviously our cancer patients or patients who happen to have cancer, we try to teach them about nutrition, but we also try to teach them about reducing calorie intake, right, to improve longevity and reduce symptoms from chemotherapy. But by teaching them the intermittent fasting, we're able to teach them how to do block fasting a lot easier, and we're able to get them into a ketogenic state more often. And I have to say, it has had the most impact, and it's free. So it's knowledge, and we empower them to have something in their pocket to take for the rest of their life. And it's, it's really old medicine brought back to new again. And hopefully, I don't think it's a fad. I don't think it's fashionable. I think what's going to happen is people are going to take this information and again, it's going to empower them to be able to take care of themselves and heal a lot of our gut problems. And it is really true. We're constantly feasting, we're never in famine, and we've kind of switching that and teaching people how to go back to the old ways.
Yeah. Have you seen any interesting trends, or maybe something in particular you've noticed lately among your patients that's kind of stood out to you?
Aside from the fasting, because
Yes.
that's all they want to talk about.
Is it? Yeah.
Well, it's been incredible for me because, so ketogenic diet, we know low sugar is going to help anyone who has an inflammatory process, especially cancer, because the cancer cells love sugar. And I just find that it's helpful on so many levels, like we mentioned before, with anything going on with the GI tract. The body can heal if we give it a rest and let it reset. But the beauty of this fasting is that I'm finding patients who are able to lose weight that weren't able to. It's resetting and increasing their growth hormone levels. It's increasing BDNF, which is this powerful brain product that's going to help us grow new brain cells. And so In the long run, it's all about inflammation, right? And what we've always been taught, that it's either a lack of nutrient that's keeping the body from being able to do what it needs to do, or it's some toxin that's blocking that nutrient from getting in, right?
Yeah.
So for me, it cancels all of that out. It helps to cancel out any of the bad foods, which of course in New Orleans we don't have bad food, but it might not be quite as safe as we want
Right.
it. It's absolutely delicious, but it can make us pretty sick. And so fasting is just, I find it to be an incredible tool. And I think that it's helped me because of, in the past, trying to sell a low-carb diet in a world of amazing food and drink, obviously.
Yeah.
And it's a social thing to eat. So I would say probably the only negative I would say about fasting is that it can be difficult being with family and friends and being in a social scene. And in New Orleans, there's something going on literally every weekend or every night. And, so it makes that part a little difficult. On the bright side, you get a lot of work done. You get a lot of things done that you can knock off your to-do list because you have a lot of time. You're not buying food, thinking about food, cooking food. You're thinking about healing and focusing on letting your cells do what they need to do to heal the body.
Can you share a story or two from one of your patients and how fasting made a big impact on their health?
Well, there's multiple stories of just when they learn how to do the intermittent fasting. It allows them to be in ketosis longer. We use meters to check their blood levels. And so whether they're just trying to use the fasting from a health perspective to try to lose weight, or they're cancer patients that have cancer, that we're trying to help teach them about the 1-to-1 ratio that we're trying to reach with the glucose and the ketones. We use this monitor, and it allows them to really personalize and specifically make their diet theirs. And then they know, look, if I eat this vegetable or this, hopefully not piece of bread, but if they do eat this piece of bread, how far does it knock me out of ketosis? And if I just have a little less sweet potato, I can get away with that. And basically they can make their diet their own and know that they're in the parameters that they need to be with the glucometer and the ketone measurements. Does that make sense?
Yeah.
And so we've had amazing success with certainly weight loss, which then reduces the cholesterol levels, which then reduces the blood sugars. And we've had patients get off of insulin. We've had patients get off all their diabetic medicines. I've had patients get off of their thyroid medicines as their weight normalizes. And obviously just in general, they feel better. Acne goes away, sleep gets better, the muscle mass develops, right? And it's probably one of the best tools, and I love the fact that it's free. I mean, everything is so expensive in healthcare these days, and we're expensive, and we know that, but we really try to teach people things that, we teach them to fish, you know that old saying. So it's been very helpful, and our focus is on nutrition, so the part we have to now get a little better at is teaching them what to eat when they're done with the fast, and really sticking to just real food. So whole fruits and vegetables and things that are from your local area that are clean, So as far as the IV side of our business, I find that we have the most success with patients because they are so inflamed. So if they come more than once, which does often happen because they feel so well, we can have more time with them to explain, other options that they can do. And if they're very sick, then we ask them to come in for a longer visit and maybe make an appointment to become a longer patient.
We'll be back in just a few minutes with more from my interview with Dr. Mignonne Mary. First, let's listen to what Executive Director Wendy Chappell has to say.
Hello, this is Wendy. If you are an ICIM member, I want to be sure you are getting the most from your membership. We have a great page on our website, www.icimed.com, where we highlight members' blogs. This is a really good way to check on the many projects and practice focal points of your colleagues, and we want to make sure that your blog is up there too. On our website, we have great opportunities for you to get some marketing advice from Luke and ISOM's own in-house team of social media and multimedia experts. We offer legal advice from our general counsel, John Richardson, and tons of emotional support when you need it. Both marketing and legal help are listed on our website under the button Member Resources. New membership benefit that you can find there is that in that same section of our website, you can now listen to past lectures for free. More good things come from membership, such as honest conversations by email where colleagues share questions about challenging case studies.
Now let's get back to my interview with Dr. Mignonne Mary.
Has there been anything that's really stood out to you? Something, maybe a specific instance of working with a patient, or maybe just something you observed that stood out?
With people feeling better, you mean? Like something?
Sure. Take it where you want to go.
We've recently been getting some patients who they tell us verbally how much better they are. So we've been asking them to write it down.
Yeah.
And so now these testimonials are coming in, and they're heartwarming, and it's the whole reason why you go into medicine, to have people respond like this. And so here's for example, we had a patient who came in for an IV. She was scheduled for surgery. She's having terrible bowel trouble and chronic constipation. One of her friends suggested she come to see us. We hydrated her and obviously gave her some nutrients. She felt so well. She slept for a very long time that night and recovered and felt very good the rest of that week. But in addition to the IV, we gave her some vitamin C that we've been using for my practice, my brother, my father's practice. I've come from a family of physicians. And this powdered C, like I remember as a child packing it for all of his patients. No one left without this vitamin C. And so we started her on it. And within the month, she's responded to us to say that not only does she have normal bowel movements every day, she was able to cancel the surgery. Her skin is amazing. She feels amazing. I mean, obviously, vitamin C is helpful for the adrenal. So I left that visit, and I didn't think I did anything for this lady, aside from obviously provide some fluids and some nutrition. But the impact that has had, to me, that's, like I said, that's why you go into medicine. It's like, it doesn't seem like much, but it was enough for her, and it's really changed her life.
Yeah. Oh, that's so wonderful.
It's awesome.
So how do you feel like as a practitioner you've transformed over the last 10, 15 years?
I've definitely become a better listener, and I'm getting better at bite-sized pieces. I have a lot of information that is not what they're used to hearing on a regular basis from their doctor, and so I tend to overwhelm. So where I'm getting better is being more succinct, and I've honestly have to give the credit to the team of people that I've hired. My staff has been incredible. They help me in so many ways, and they allow me to work better and smarter and help to continue to educate the patient, because at the end of the day, my goal is to educate. And that's what the word doctor means, teacher, right?
Yeah.
And so where I've learned and where I'm trying to get better is working more towards hopefully keeping people from getting sick, right? And trying to find the pearls and the things that they can do on their own so that they don't have to see the doctor. And that has a lot to do with the food and the food choices, but it also has to do with the nutrients. And so where I'd like to get better is I don't want to be a doctor that just continues to give more and more supplements, right? I don't want to be just a natural version of a pharmaceutical company, right? Giving drugs. But we need them sometimes for a short term, right? To get them over the hump. And then, like I said, once we teach them the tools of how to eat better and what foods are better for them, then they can do it themselves, right? And knowledge is power. So, and my favorite part of my practice that has changed is that I really love watching the very fast turnover and watching people get well really quickly. So, the hangover is an easy one that I feel like it's really fun. It's not quite as challenging, so I'm enjoying some of the sicker patients and enjoying watching them get well. But I'm very impatient, so I love that quick turnaround. So it's something that doesn't happen in medicine a lot. So it's pretty cool to see. Yeah.
So you have obviously a lot going on. What's next? Looking at at the horizon, what's coming up?
Well, currently we're working on trying to recently we've saved a lot of weddings. For whatever reason, in October we have a lot of wedding parties, and there's brides who have been sick on their day. And for me, that's really why we opened, so that you have a place to go when you really cannot afford to be sick, right? And then on the horizon, I plan to do more speaking engagements and teaching. I'm about to give a talk about vitamin D, and hopefully just continue the education process. We've opened up a new location on the North Shore of our city, and hopefully grow the hours and the days for that. and I hope to expand and talk more about vitamin C. My true passion is from the history of my family and my dad getting into using high-dose vitamin C intravenously. And, I'm at this conference where these are all the greats that they're all learned from the same greats. And so it's incredible to be around this group of people and their energy and their knowledge and to see their results. Like, I've loved today's talk. We talked about results-based medicine instead of just evidence-based, and that's what we have. Where we are getting results, we get people well, and it's the turning point is happening where people are coming to us this flu season instead of just an urgent care, right? And they want to get better, and I think people are more proactive than they've ever been. So I guess the horizon is education and providing people with the top knowledge and the best and most the freshest information.
Yeah. So one, I love how it's easy to tell how excited you get about what you're doing. What would you thinking back to when you were in med school and thinking about what would you say to those young the students going in training, whether they're in the residency? What would you say to them?
I would say really learn how to read a study, learn who paid for the study. I would say eat your lunch somewhere else instead of with what the pharmaceutical industry comes to pay for, because that's who bought every one of our lunches. And know that there's more than the AMA out there, that there's organizations like ISOM that do their very best to present exactly what we said, the freshest, best information that's getting results. Because at the end of the day, we can all get into the rat race and prescribe pills and just see people for 5 minutes. This system is broken. Yeah. And so I would say they have an opportunity to change the system completely.
Yeah.
And I think, and I remember when I was in med school and the whole class, we're going to be doing our best. And I just went to my school reunion, and I was pretty sad to see that most people were just going through the motions. It was like they were not really happy. Like my job, it's not a job. It is not like going to work. I have fun every day, and it is exactly what I thought it should be when I was in school. And I want that for them. I want them to love medicine, and I want them to have the results that we have and have people feel so well. That ripple effect is massive, and that is the goal of why we went to school. So I want to tell them to say, keep your eyes open, be open to other ideas, and read the studies for yourself.
Thank you. Real quick about ICIM, tell me how you feel like participating, like being an ICIM member affects you as a physician.
I think it gives me the most up-to-date studies and information of what's going out there from my peers who are doing similar work, right? IV therapy, this is the group that's been doing IV therapy for years. Yeah. My family has been doing it for years as well, but this is the group that's been really heavily involved in teaching people about chelation. And I think it's always important to keep, your finger on the pulse of what's going on, but also to have connection with these doctors so that if I do have any questions, I have a support group. I feel very comfortable being able to call any one of these doctors if I had a case that I needed to confer about. And so the most important thing is support, and knowledge.
Yeah.
So it's great.
Awesome. Any final thoughts for those listening?
Oh my gosh. Drink your water and take your vitamin C, of course. Yeah. So thank you so much.
Yeah. Thank you so much, Dr. Mary. I appreciate it.